Assalamu alaikum wa rahmatullah. This is the presentation for lecture 4. Last lecture we talked about dental caries indices, all about dental caries and the uses, the types of indices. Today we will talk about indices used for periodontal disease assessment. First of all, we'll start with the definition of periodontal disease. Periodontal disease is a term which includes all pathological conditions of the periodontium, which include gingiva and supporting structures. It starts with very simple gingivitis, redness, simple inflammation. When it's neglected, it's reached to the last step. It could be reached to the last step, which is destruction of the bone, which is still the most important criteria of assessment of the severity of periodontal disease. There's many etiological factors for the periodontal disease and many types. We will start with gingivitis. Gingivitis is an inflammation of the gingival tissue, mainly caused by dental plaque. As we can see here in the picture in front of us, there is on the right side there's healthy gingiva with very nice pink color. On the other side, the patient has inflammation, redness, and very bad appearance for the gingiva. This is the difference between healthy gingiva and the gingivitis. If it is neglected, it will move to the next step, which is periodontitis, which is an inflammation of periodontal ligaments, mainly preceded by an untreated gingivitis. As you can see here in the picture below, the affected tissue is the tissue around the tooth itself. This type of periodontal disease, when it is neglected by the patient, it could be reached to the next step, which is pocket. It's a very bad condition of periodontal disease. Dental plaque is one of the periodontal disease, which is very common, by the way. It is soft, non-mineralized bacterial deposit formed on the tooth surface. All of you have seen on some point the plaque, which is a very yellowish color, could be removed by the probe from the tooth surface. It's very common all around the world. When it is neglected, it could be moved to the next step, which is calculus. It's hard deposits that's formed by the mineralization of dental plaque. The picture below showed the calculus. How could we know the bone loss in the teeth? We have three approaches to measure the bone loss, which is gingival crevice measurements, radiographical evaluation of the bone loss, and assessment of the gingival recession and tooth mobility by a probe. Of course, we could use the manual method to assess the gingival recession and the mobility, which is grade 1 or grade 2, etc. Here in the picture there is an example of radiographical evaluation of the bone loss. On the left side there is a very healthy bone level. It's obvious. On the right side there is loss in the bone, and I think it's between the 5 and 6 and less in between the 6 and 7. So it's obvious the effect of this on the tooth stability and healthiness of the tooth. Now we will talk about periodontal indices. Periodontal indices have two kinds. First one is the Periodontal Index by Russell, invented in 1956. And the second one is the Periodontal Disease Index, PDI, invented by Sigurd and Rampjord, invented in 1959. The first one is explained both of them explained in the lecture, but we will focus on the second one, which is the most important one, and it's called the Ramp-Jordt. For its importance, it's called the Ramp-Jordt Periodontal Disease Index. It has three components, which is gingival and periodontal component, a plaque component, and calculus component. Talking about the periodontal component, gingival and periodontal component, it have a criteria or score from 0 to 6. 0 is the normal gingiva. 1, 2, 3 represents the gingivitis, from simple gingivitis to moderate to severe. 4, 5, 6 is the periodontitis, reaching to the end stage, which is loss of attachment. This index measures the presence and severity of the disease. It measures both gingival and inflammation and sulcus depth on 6 selected teeth. Keep in mind that you have to register or examine the gingival status first, then you will move to the gingival sulcus examination. For sure, if there is any loss of attachment, the score of gingivitis is disregarded for the same tooth. All areas is scored as one unit in this index. Component is the plaque component. In this index, the criteria used ranged from 0 to 3. It's assessed the very gentle movement of the probe. In this case, using the discoloring agent, which is a very simple way to measure the plaque assessment. It's an agent putting on the teeth, waiting for a few minutes. The plaque will change color to a different color. In the picture below, it's purple color. It's very easy way to assess the the plaque, especially for the students. A very important point in this index is only for fully erupted teeth are scored. The calculus component criteria for this index is ranged from 0 to 3. 0 represents the absence of the calculus, reaching to the 3, which is the supragingival and subgingival calculus. In this index, it measures the extension of the calculus, only facial, and this is a very important point, only the facial and lingual surfaces is examined or assessed in this component or in this index. Third one is the Community Periodontal Disease Index for treatment need, which referred to it by CPITN, which is invented by the WHO and FDI in 1982. In this index, we use the WHO probe. It's applied by using this probe on the sulcus of the tooth. This probe is, as you can see in the picture below, it's a very long one, which a blind end, which have a ball in the end of 0.5 millimeter in diameter. Very light in the weight. It's need a very gentle strength. The power used in this case to move this probe in the sulcus is just 20 grams. So it's a very gentle movement to know if there is a periodontal disease. Our sign is the bleeding or simple bleeding from the sulcus. This probe is called the CPITN probe as well, and used in epidemiological studies. It's really useful in this kind of studies, and it's really common to use in the clinic. Moving to the fluorescence indices. First one is the Dean's Fluorescence Index, modified criteria by Dean in 1942. This index has been used to most frequently over the years to assess fluorosis. Only only two most affected teeth are used to record the fluorosis by the examiner. If the two teeth were not equally affected, the score given was that of the less involved tooth. It's very important to know the definition of the fluorosis and the appearance of the fluorosis before assess the teeth for this kind of disease. To know that dental fluorosis is the appearance of faint white lines or streaks on the teeth that only occurs when younger children consume too much fluoride. You can see in the picture below the patient has yellowish color on the teeth. It's generalized fluorosis, and it appears in the patients, adults or children, with high consumption of fluoride. If they intend to consume the fluoride or not, it's common in our community. Finally, there is the Community Fluorosis Index. This is index, as it is obvious from the name. It's used to assess the severity of dental fluorosis in a group of population or a community. It's never used to assess the fluorosis in individuals. A very important point to know that this index has a numerical statistical value weight as a score of each degree. There's no details, there's just numerical values. Also, this is a very important point, by the way. Also, there is a very important formula to assess or to calculate this index at the end of the lecture. Thank you very much for your listening.